Hello and welcome to McKesson Idea Share Radio at McKesson Idea Share 2024 in New Orleans. My name is Vanessa Brown, and I'm not only a pharmacist with about 2 decades of retail under my belt, I'm also part of the marketing team that helps our Health Mart pharmacies. Today, we are talking about something that is very near and dear to my heart, charitable pharmacies. They're a crucial resource for the communities that they serve, and today we get to hear about some inspiration, operational aspects of running a charitable pharmacy, and hopefully you discover ways that you can contribute to this noble endeavor yourself. Today with me, I have a special co-host, Melanie Dorigo. She's also a pharmacist and a vice president of pharmacy retail operations. She works collaboratively with our field sales and our pharmacies, and today she has brought a very special pharmacy with her today. Melanie, thanks for being here with us.
Thank you, Vanessa, and it is my privilege to have introduce our guest today. Ritesh Shah is the founder of Ritesh Shah Charitable Pharmacy in Red Bank, New Jersey, established in honor of his late sister. The mission of RSCP is to provide vital medication to those underserved communities, and to date, RSCP has filled 5,000 prescriptions and saved patients over $600,000. As the CEO of Legacy Pharmacy Group and New Jersey Leaf, Ritesh is dedicated to supporting independent pharmacies and advancing patient care. Recognized as the 2010 Independent Pharmacist of the Year, he has the privilege to serve the community through innovations like the Bayshore Senior Center's Patient Education Center and Generation RX. Recently, he was featured on the cover of American Pharmacist magazine. Ritesh is honored to be here with us today, committed to making a difference. His journey has led him to this platform, and we are very privileged to have him share his insights with us.
Thank you, Melanie. Thank you, Vanessa.
Thank you for being here. Wow, what an introduction. So many accolades. You have been able to tell your story to a lot of people already, and I can't wait to hear it today. So I read an interesting statistic from the National Association of Free and Charitable Clinics that there were about 1,400 free and charitable pharmacies in the United States. When you think about how many pharmacies we have in general, that's not really a lot. So what is a charitable pharmacy, and how are they different from traditional pharmacies?
So traditional pharmacies are for fee-for-service, where the profit model is made. Here, if you see in the state of New Jersey, there are about 2% population that falls through the crack, where either they have to decide whether they want to use that money to buy insurance, or they don't qualify for Medicaid and Medicare. So what happens to those lives? Very simple mission of opening this segment of charitable pharmacy from our heart for the community was when we lost one life from our life, when I lost my baby sister. The thought came in as a pharmacist. I'm married to a pharmacist. It's like, what happens to the people who don't have any means of getting this? So that's where this charitable pharmacy was born. It is totally different than a community retail or chain pharmacy, where here there is no financial model, if that makes any sense.
Can you expand on that no financial model?
So what happens to anyone who lives 300% below federal poverty line, who do not have insurance, and struggling to get life-saving medication like diabetes, heart medications, mental illness, and nutritional. Those medications, about 300 plus, we have in our formulary at the charitable pharmacy. We work very closely with the safety net clinics, and prescription written for those underserved and underinsured and undocumented patients. They come to our drugstore, and we fill their prescription at no cost to them. There's nothing. There's no money asked. There's no cash register in our drugstore.
No cash register in a pharmacy. I don't think I've heard that one before. You touched a little bit on the reason for this was for your baby sister. Can you tell me more about that?
So, I wear a couple hats. One of them, which I enjoy as a CEO of Legacy Pharmacy Group. When we walked into pandemic, we know there was a call for pharmacists and healthcare workers to save those precious human lives. In New Jersey, we work very closely with a lot of government facilities, the senators, the legislators, and we have done more than about 1 million plus COVID specimen collection. In October 2021, I decided to go to the country of birth, which is India, to meet my baby sister to celebrate Diwali, the Festival of Lights, which I promised her that I will do. As we all know, the COVID had a surge in India at that time, and not only in India, in everywhere. And as I landed in India to meet my baby sister to celebrate this festival, she had contracted that virus. She was on a ventilator, and she could not wait for me. I lost her as I was 20 minutes out from airport to the hospital, and that really shook me up. And during the prayer ceremony after her passing, we took a oath and we made a promise to ourselves when we go back to our home in Freehold, New Jersey, we'll do something more meaningful in our life. And in her honor, we dedicated our entire building for this purpose. Personally speaking, I was really going through a tough time, not having your younger sibling in your life. But my wife, who is a true champion, a pharmacist who retired because she didn't have to work, God is good to us. She told me, Ritesh, I'll put my white coat on and I'll go back and I'll serve. There's no payroll at our pharmacy. There is no rent of the building. And we personally self-funded this entire mission. Then a lot of family and friends joined, and this pharmacy was born. Even when we went to State Board of Pharmacy in state of New Jersey, they have not heard what charitable pharmacy is. They could not even classify us. So they just threw us into the retail pharmacy segment. And there is no controlled substance. There is no prescription billing through BIN number or NPI number gets billed through. It's purely the mission of saving patients' life. Because I always say this, when one life went out of from my family and shook us up, the goal became, let's help people who really has no means of getting medication and really struggling to get the medicine, so we can save and we can do our part as a good citizen of the community that we live in.
Wow, that's for you to take a tragedy that has happened in your life and been able to turn it around and do such a noble endeavor. I really thank you for that. I'm sure it was very hard, and I really appreciate the work that you are putting in for your pharmacies and your patients. What has been in this journey your biggest win along the way?
The biggest win, when those underserved and those patients, when they walk into the door and get those medicine, which they never got it before. Allow me to share these statistics that my kids, they have done, and few of the doctors, those who are student doctors, have done this research with the Kaiser Foundation. About 4,000 prescriptions in a county that I live in, Monmouth County and Ocean County, never reaches to the drugstore. They get unfilled. Doctor writes the prescription from either emergency room, this one. They say, oh, this is gonna cost me $100, $200, or if it's insulin, $700. Never reaches to the drugstore. Very painful as a pharmacist. What happens? Practicing as a pharmacist for 20 years in my retail drugstore that I own, so many times when I have seen those cash patients, I had take a lot of discounts and give to them. I said, you know what, if it's $30 and insulin, and said, hey, I don't have $70. Can you give me medicine for $50? And we have done this. So now, just inspired by this personal loss, and we want to help those people who don't have, we never met them in our life, we never seen them in our life, to help them and seeing them. And now you are doing God's work and giving that a precious, aiding something into their life. It gives me immense joy. I think words cannot describe this.
That's amazing. Sometimes it's just that one thank you that can carry you on sometimes for days, weeks, and months, maybe years. And so I'm sure all the smiles and sense of relief that you bring to those patients is really driving your pharmacy forward. You said your wife's involved and your kids. Tell me a little bit about how this pharmacy runs.
So when this thought came in, the foundation was born. New Jersey knows, having been there in a retail community pharmacy and taking some leadership roles, there was a call and I reached out to a few members of community, those who are out there, they joined our advisory board, and they started became a guided torch for me and guided me navigated through. If you see every board member, one or other way they're giving back to this foundation and to the pharmacy. Giving one example, one of our attorney, when he found out that I'm doing this solely out of my pocket, let me tell you, he sent his retainer check back. He said, Ritesh, I'm never charging you for my legal fees. And when I asked him, why do you want to do this? He said, well, my dad had diabetes. And for that purpose, I want to honor the services to my dad. Joe Howe, our superintendent of Freehold Schools, he lost his dad with cancer, and he's dedicating a lot of his time and resources for this. So many people got attached with our mission. I feel so proud that God gave me this direction to open up this mission so we can help so many lives that we want to touch upon. So the board is amazing. Our information, it's on our charitable pharmacist website and their bio that gives you enough information about our mission.
So you've got a lot of board members that have contributed their time.
Absolutely.
Some financial aspects of it. How do you run the day-to-day?
So, first year and a half, my wife was there every single day because, as I said, there was no payroll. I volunteered once a month there. Pharmacies open about 20 hours, so we have one part-time pharmacist, and we also have program director. But we have a lot of volunteers comes from Brookdale Community College and the other college that they're associated. And believe me or not, there's a shortage of volunteers. And we sometimes struggle. As I said, this Friday, I'm volunteering because there is no pharmacist available. So I want to make sure the mission doesn't get compromised. So in a day-to-day, it runs through volunteers, runs through a pharmacist, and the mission goes on. Today, we are serving more than about 300 patients, and they come for maintenance refills every month. We partner with Union County, which is about 40 minutes from there. There's a desert of a lot of homeless people and underserved people lives. So we picked up some lives from there, and we provide blood pressure medication, diabetes medication, also some life-saving insulin. We provide them at no cost. So it's God's work. I think God sends that message, and those are angels that comes to protect you, I guess.
Melanie, one of your angels?
I actually met Ritesh 2 years ago at this very meeting when I had just come on board with McKesson, and I very much appreciate his partnership. I know through our work together with Legacy and McKesson, we talk a lot about diversifying revenue. We know for our independent pharmacies, cash flow crunch is out there, and we're doing our best to help them, but that wouldn't be the same for the charitable pharmacy. So would you talk about what sort of impact that is a little bit different than a regular retail pharmacy for your charitable pharmacy?
Absolutely. Well, here at the charitable pharmacy, there is no income coming from patient side, right? They are not paying anything. So you rely. Well, here at this organization, we decided, and my family and I, we had a very detailed few meetings before we took this step that, hey, can we do this and can we make this more sustainable? So the board members, they constantly go out and reach out to the organizations. And also, there are big organizations, they see our mission. And Bank of America, the Count Basie Theater, they heard. We didn't reach out to them. They reached out to us, and they started supporting us. So when you do the good work that comes in, and in the beginning, the question always came in, like, how do you make it that sustainable, right? And because there is no income. So we are self-funding it, but also a lot of family and friends are self-funding it, and they're helping us in this mission. So it's totally different than regular pharmacy, because where money is coming and profit is coming, and you're running those operations. Here is solely going in this direction.
Yeah, that's incredible. And I remember from when we first met, you sharing the story about your sister, and also, your wife. I just want to give another shout out to your wife for all her hard work and dedication at the pharmacy. I know she's been there day in and day out, and it's just incredible what you both have done. But Where can people find you? Where can patients find you? How can we help patients find Charitable Pharmacy? What are some of the resources out there for them?
Great question, Marissa. So what happens here? We have partnered with the safety net clinics. So Parker Clinic in Monmouth County, also VNA of Central New Jersey, St. Peter's Hospital. So all those doctors, we went out there and we talked to them and told them, hey, don't let those patients go. When you see them and their hemoglobin A1C one time is 11 and now it's going 13 or 14,
Yeah.
you know they're not taking medicine. So send them to them our way because we have those resources. And word of mouth, constantly growing it, reaching out to legislators, having them, and social media, promoting it. And you know what? I know this for sure fact. When you talk to one person and he passes on this message to the other person, hey, this happened. Uh, in a Middletown, that we had one veteran who had income coming, took a big fall, had a unforeseen expenses came of hospitalization. He couldn't catch up on his electricity bill, his light bills, and he reached out to us and he was afraid to put his hand like this, asking something because that person had a dignity and he didn't want to ask. But when we found out through the church, we reached out and said, hey, we can fill this prescription for you. You know what? And those 2 months that when he had that coverage gap, you know what? He felt, and his family reached out to us, which was our state, and said, "Hey, you know what, you kept him alive," and then his insurance kicked in and he moved on. So those kind of work is being done by Ritesh Shah Charitable Pharmacy. I don't know what future entails, but we know there will be people that will be falling through the crack, and this pharmacy, our amazing team, will be helping them.
Yeah, that's incredible. We don't often think about the patients that are in a gap phase, right? They could lose insurance for some reason, not be eligible, like you said, for Medicare or Medicaid, and that's such a vulnerable population. So thank you so much for helping those out. And I know, Vanessa, you have some experiences with Charitable Pharmacy as well, and this is near and dear to your heart. So any other things that you want to ask Ritesh, or what are some things left on your mind too?
Yes, you talked about having your wife as the one that's leading the charge, spending most of the hours volunteering and her time and effort in there. But for others who are thinking about starting a charitable pharmacy near them or wanting to volunteer or somehow get involved, what's some tips that you would give anybody listening out there? Technicians, owners, pharmacists?
Uh, Great question. God has given us beautiful life. So whatever religion, whatever you follow, right? It always tells you to give back to the community. And if you're looking for that place, if you are in New Jersey, Charitable Pharmacy is the place. We are looking for volunteers, whether it's 1 hour or one day. We have one pharmacist, Lizzie, comes once a month for 5 hours. And she works for the chain pharmacy. And she reached out through the newspaper article that it was in a media. And so you know what? No donation is a small donation. They can financially support to honor of whatever their relatives are or their friends or families are. Most importantly, they can give time. Not only we fill prescriptions on location, but we also go into the school systems. We have Red Bank Regional School System, Freehold Borough School Systems, where we have a lot of underserved kids. They don't take that vaccination. So we want to make sure the community is healthy. So we buy those vaccinations. It costs a lot of money. So that's why financial support, comes up. We are committed, we'll do it. But those students, in numbers, good numbers, 300 students, now they're healthy, they're attending school, now they're getting education, their parents are happy. So it's like full circle. When you give back and when you put that small piece of puzzle into that equation, it goes a long way. So hey, we're welcoming anyone who want to support. Our website is rscprx.org. New Jersey has one and only, which is inaugural charitable pharmacy. So love to have it. You're a pharmacist. You took oaths to serve. So in your lifetime or in your year time or in a month time, if you give few hours, 1 hour, it goes a long way for the needy people.
Well said. So we can volunteer, we can donate financially, we can just reach out to a charitable pharmacy or near us, we can reach out to your pharmacy and just find ways to give back.
Yep.
Thank you so much for telling us your story. I am so glad to get you on this platform and spread the word. Melanie, thanks for being here.
Of course.
Thank you for all the work that you're doing. Thank you for all the work you're doing and continuing to do. I know that your family is very proud, your board is very proud, your community is, and also the state of New Jersey. So thank you for everything that you're doing, Ritesh. Really
Thank you so
appreciate
much.
it.
Thank you.
Thank you. This is McKesson Idea Share Radio, your source for pharmacy inspiration and innovation. Stay informed, stay engaged, and keep sharing your ideas. This is McKesson Idea Share Radio signing off. Until next time, keep up the great work.